In this lesson, we'll review the role and responsibilities of an insurance verifier. As a result, you'll be able to list key duties and skills related to billing for your clinic's insurance verifier. In this lesson, we'll review your roles and responsibilities as part of a health department's clinic's billing team. You don't have to memorize every duty. A job aid explaining the job duties for you and each staff member will be available for you to download and print out. While the insurance verifier is a separate job, it doesn't necessarily need to be filled by a separate staff member. This role is responsible for contacting the patient's insurance company to determine their benefits. This can be accomplished by phone or by going to the insurer's website. It's helpful to maintain a list of frequently called numbers and to bookmark websites to expedite this process. It's important to complete insurance verification before the patient receives services, or if that's not feasible, as soon as possible.
Hi, this is Athena Kinsley, Health Insurance Specialist here. I'm going to walk you through a short example of a situation you might encounter when verifying a patient's insurance information. A patient, let's call Mr. Smith, came in for shingles vaccine. Our insurance verifier, Sally, called the patient's insurance to verify his benefits and documented that she spoke to Jane at the insurance company. Jane gave Sally the benefit details and a tracking number for their conversation. Sally explained the benefits to the patient and his vaccination was given without a charge. 5 weeks later, Mr. Smith calls your clinic wanting to know why he has a $200 balance owed. His insurance denied the service because your clinic is out of network. Sally took the initiative by setting up a three-way call with the patient and his insurance company. Sally explained that she had spoken to the insurance representative, Jane, and she gave the tracking number. After reviewing the records, the insurer admitted to Mr. Smith that the representative, Jane, had given the wrong benefit information. They resolved the issue by reprocessing the claim and paying the $200 balance to the clinic. By taking the time to write down who she talked to and the tracking number, Sally was able to help the patient understand what happened and get a resolution. This is a way to turn around a situation and show your clinic is both competent and responsive.
To serve as an insurance verifier, you should have basic knowledge of healthcare and insurance terminology and excellent communication skills. For many clients, their insurance coverage is a mystery and can be overwhelming. The insurance verifier needs to educate patients about their benefits, while also being respectful and sympathetic. Patients will be waiting during the verification process. For scheduled services, you may even consider verifying insurance coverage before the patient arrives on site. Now please follow the instructions to take the quiz for this lesson. It will look familiar. It's the same one you took before viewing the lesson. This time you'll be able to see the correct answers as you respond to demonstrate what you've learned. After you've completed the quiz, you may continue at your own pace to view subsequent lessons at your convenience. The lessons are ordered so you'll build your knowledge of each part of the billing process that relates to your role. When you finish all the lessons, you'll be able to print out a certificate of completion to reward your efforts. Thanks for your attention. Please continue on to the quiz.